my name is Mohamed Navab, and I'm a professor at the Division of Cardiology, University of California, Los Angeles. And I will be presenting on small intestine, genes, systemic inflammation, and cardiovascular function. In the early 90s, we reported that HDL from many individuals is dysfunctional in that it does not prevent lipid oxidation. It's not protective. Instead of being anti-inflammatory, it's pro-inflammatory. This started from patients with atherosclerosis, diabetes, obesity. Colleagues, Dr. McMahon showed in lupus, Dr. Christina Charles showed in arthritis. Friends, colleagues who worked on sickle cell anemia, on fibrosis of liver, etc., showed that the HDL composition was different and therefore was not protective. We developed an assay to determine this, and in year 2000, in collaboration with Dr. G.M. Ananthamaya at University of Birmingham, Alabama, Dr. Jerry Segrist, who had been working on ApoA1, developed a peptide, 18 amino acid peptide, which had 4 phenylalanines, therefore we called it 4F. And we showed in preclinical studies that it prevents lipid oxidation, inflammation, and helps with a variety of diseases from atherosclerosis, heart transplant, Alzheimer's disease, arthritis, etc., diabetes. And with Dr. Dan Rader at UPenn, we tested it on 150 patients, 2 clinical trials, and it improved HDL. It did not have side effects. This was oral high dose. Then with Novartis, we did 150 patient clinical trials in US, Europe, Africa, and Israel. And this one was low dose injectable, and it did not result in what we expected. So we went back to the mouse model, and we found that the effect of the peptide is in the intestine. And even though it doesn't show in the bloodstream when you feed it orally, still reduces serum amyloid A, improves HDL, and affects cardiovascular function. Colleague Dr. Srinu Reddy and group with Dr. Fogelman, the chair of the Department of Medicine and my mentor, our head of the project, Dr. Reddy and colleagues expressed it in edible plants, for instance in tomato, and showed that it prevents colon cancer, ovarian cancer is in the works, and we showed that it reduces atherosclerosis. And looked at a variety of genes, some of them that increase with high cholesterol, high lipid feeding were improved and reversed by feeding this peptide that was being expressed by the edible plant. And we are pursuing those studies. The reason we went for expression in the plant was that making it by chemical synthesis is expensive. It's not practical. So at this time, we are continuing those studies. We have found that lysophosphatidic acid is a major component that is induced by high fat, high cholesterol diet, and feeding LPA does mimic the high fat feeding. And this lysophosphatidic acid is a tumor promoter, is also atherogenic. And we continue that work and work on the genes that, like IRE1 beta and MTP, that the peptide reverses the effect of high fat feeding.